How are you? Good. It's nice to see you again. How have you been keeping? Great. Well, I have your blood test results and your X-ray results, and I'm pleased to tell you that both are clear. Alright. Yeah, I thought so, but I'm glad we've definitely got confirmation of that now. Alright. I am going to refer you on to the orthopaedic specialist, okay? Yeah. I am not going to get you a scan done. I thought I would leave it down to them if they would like to get you in for a scan, if that's alright. Okay, brilliant. So, okay, I've put a note and request on for my secretary to do the referral for you. Okay, yeah, but I am thinking that you may have joint hypermobility syndrome. Okay, have you heard of that before? Okay, a lot of people are flexible and have joint hypermobility. Some people it comes with a syndrome, and you can experience a lot of chronic pain with that. Pain around the joints, stiffness, different things like that. Okay, would you say you're quite flexible? Okay, not overly. So, a patient of mine actually has joint hypermobility syndrome, and they're not particularly that flexible, but after extensive assessments, they have confirmed that they do have that. So there is a possibility that you could have the syndrome without actually being extremely flexible. Alright. But the orthopaedic specialist will be able to do an assessment for that. Alright. And they will have a good look at you. Okay, it's probably about an hour or so, the assessment. Yeah, they may want you to go to a physio, but not always helpful when you've got joint hypermobility syndrome. Okay, and they will probably suggest you see a podiatrist as well. Alright, you were saying about your feet and things like that. But the specialist will have a look. If they feel you need to see a podiatrist, they'll literally contact the department for you. Get that sorted. Yeah, I mean, a lot of people, they can experience inverted feet, flat inverted feet, all sorts of different things. I mean, how's your balance? Right. Okay, can I just jot that down? Thank you. Would you say you can be quite clumsy? try and rush it through for you. Okay, I'm hoping you haven't got to wait longer than 4 weeks. Okay, but I insist the department is quite busy, so maybe a little bit longer than that, but I'll do my best. Okay, great. Yeah, that is a possibility as well. I mean, do you have anybody in your family with osteoarthritis or rheumatoid arthritis or anything like that? No, the bloods were negative, but okay, they'll be able to check out for arthritis anyway. Yeah, be able to tell the difference and things like that, and they may do you a scan, or they may even offer you a bone density scan or something like that. Yeah, depends what their thoughts are, and they will ask you a lot more questions and carry out all sorts of different tests and things like that. Okay, yeah. Joint syndrome. Chronic pain. Do you mean fibromyalgia? Right. There could actually be a possibility. Yeah. Now you've mentioned it. Well, the orthopaedic specialist is a good starting point. They will have a look, see if there's any signs of arthritis, joint hypermobility syndrome. They will see if you need to see a podiatrist to get your feet looked at. Alright. They may want you to see a physio or something, but they may think, let's go to a rheumatologist and have an assessment for fibromyalgia. However, they are more than likely going to shove it under the carpet, if you like. Yeah, there's, not many out there who kind of believe in that kind of thing, and they always try to shove it under the carpet and things like that, and depends how good the doctor is, to be honest with you. I will mention it on the referral about, possible fibromyalgia. Yeah. But they may think, okay, we'll refer you on, or they might just think, but probably because they're not trained in it and they don't understand it. Not many people do understand that. However, don't think I'm going to leave it there. Once I've read their report and things, if I feel I need to send you on, I will refer you to a rheumatologist for an assessment. Okay. Now, I had somebody else ask me that actually, saying, is it a neurologist? And I'm saying, no. And some people have said that they saw a neurologist and got diagnosed. MS is, can get confused with fibromyalgia. So, to get diagnosed with MS, you would see a neurologist. So, they could have had an assessment, have a scan, and then they said, no, it's probably fibromyalgia. Maybe that's where the confusion has been. But the rheumatologist would actually be the one that diagnoses you. Okay, that's correct. They'll be able to do a proper assessment and things like that. But don't worry, I'll keep an open mind about that. I will do. I will get you to them first and we'll work our way through that way, if that's okay with you. Good. Yeah, but we'll get that sorted out. So they might not want to do a scan, but then you might find that the rheumatologist might want to do one. So it just depends on. We tend to refer to the orthopaedic specialist first. Yeah, especially when you're showing your symptoms that you are showing. Yeah, but then we can go from there really and see which is the best route for you to take. Unfortunately, it's the way we do things here. Yeah, that's correct. Okay, let me just pop that down. Okay, well, maybe if you do get a referral to see a dermatologist and they diagnose you with fibromyalgia, I could always send you to a neurologist then for a brain scan. Yeah, so somebody else in your family has MS, is that right? Okay, and who are they to you? Okay, let me just pop that down, okay, because that's good that you told me that, thank you. Okay, don't worry, we'll get these tests sorted, alright? We'll give you all the tests that you need and treatment and help and everything like that. We'll be here right the way through. Okay, don't worry about that. I'm sure you'll be fine. Yeah. Definitely, you can definitely have more than one of those things, yeah. I know people with several different conditions. Yeah, not to worry, but we'll sort this out. Okay, so you're happy with the sides on the pain and the things like that? Great, so you're happy with the plan on where we're going to go forward? Okay, wonderful. That's good, I'll get that sorted straight away. Now, I want to talk about your acne, suspected acne. That's right, I'm going to pop some gloves on first, okay? So how's your skin been? How have you been feeling? Yeah, I can see a bit more of a flare today. Got a bit worse, you stressed or... Okay. Oh no, don't worry. Honestly, I'll get this sorted. No, I bet you're feeling like everything's all top of your once, aren't you? I know. But please don't worry. Okay. Come nice and close to you. I'm going to have a little look first. Okay. Just at the new breakouts and things that I can see. And I'll see what we can do. Alright. Great. Have you got anything on your face at all? Okay, perfect. That's fine. Alright. Okay. It's quite a hard boil there on your chin. That hurt. Yeah. How long has that one been there? Okay. I can feel a lot of breakouts under the surface of your skin. It doesn't feel oily. Okay. Does that hurt as well? Okay. Feel just the edge of your chin. Along your jawline, some bumps, but no actual spot. Or here, okay. Okay, your chin, you've got the obvious place there. But when I go like that, I feel lots of cystic lumps to the surface. I'm not sure whether they will get a white head, whether they'll stay cystic, but at some point these will be coming to the surface, okay? But then they can be hard to get rid of, but it's also good that they're out, if that makes sense. You just drink lots of water for me. Does it hurt? That's fine. Great, it's all fine. So this here. I mean, your cheeks are very, very red, okay? And I can see some bumps underneath the skin, okay? Obviously you've got the obvious on that. But I'm going to feel. Ah, yes, definitely. I can feel lots of cystic lumps. Yeah. All on your cheeks. Okay. Forehead. Okay, so you've got obviously that one there. Your forehead. So, here is your hairline. You've got some breakouts. I don't know if you've noticed that before. Have you got any in your scalp? On your back? Okay. Yeah, I can feel all sorts on the surface. So, okay. Let's put that. Looks good. Okay, I definitely think this is acne. I really do. Typical kind of acne there. Mm-hmm. Yeah. Okay, my love. That's fine. Yeah, I do think that's acne, okay. Okay. Would you like to see a dermatologist at all? Would you? I think that would be better for you. I don't mind putting a referral through. I can start you on some antibiotics because the dermatologist will probably want to know if you've had some kind of treatment before being referred to them. Yeah, and if I haven't done that, there might be, I can give you some antibiotics and a special wash for about 8 weeks. And then I can get you in for a review. Then I could possibly refer you on, thinking it may just need to be a bit of a process. Okay, just let me put that down. So I'm going to give you antibiotics and wash. Wash twice a day. Antibiotics once a day. Possible dermatologist. Treatment. Okay, so the dermatologist will be able to give you a proper diagnosis, okay, treatment plan, and go through some things with you. Okay, so I'm going to refer you. All right, you looked a little bit stressed when I said I'd have to wait. Okay, I refer you on dermatologist for a full assessment, but I will also write that I have started you on the antibiotics and a special wash. Okay, so I'll do that for you. Pass that over to my secretary and get that done for you. Here is your prescription. Okay, so I've got some antibiotics. I need you to take 1 per day. Okay, first thing will be great. Then I've got you this special wash, okay, which you need to use twice a day with lukewarm water. Okay, so pump it, lather it up so it's nice and foamy. Really give your face a good proper wash. Okay, then rinse it off. If you have got a oil-free moisturiser, that would be great to soothe it. Okay, I don't want you to use anything else. Okay, so no other skincare products. Okay, and if you can, try to lay off the makeup. I know it's a vicious circle because you want to put it on to cover it up, and you go around in circles and things like that. Okay, but the dermatologist will be able to go through skincare with you as well, sort out all that for you. All right, they'll do a really good job. They will. Yeah, I assure you. And stress doesn't help, does it? No, doesn't help at all. But try to avoid exfoliations as well, because this wash here has a special product in it that actually exfoliates your skin as well. Okay, so you don't want to overload it. And be careful going out in the sun. Don't use sunbeds and things like that. There will be a leaflet in the product. I need you to read that for me just to make sure. Alright, but I need you to get that for me. Okay, that's for you. My pleasure. Yeah, that's right. If you do that for me, that'd be really, really good. Okay, but do you have any questions for me? Or have we covered everything? Okay. Yeah, well, we have a plan, don't we? So get you referred on to dermatologist and onto the orthopaedic specialist. Possibly we'll need a podiatrist and potentially a rheumatologist, maybe neurologist. We'll see how we go. Yeah, it's going to be over a good few months. This will be a process. All right, and then we'd like to see if we can start working on your acne while we're waiting for an appointment. Okay, any problems in the meantime, please give me a call and I can see you, or I can talk to you over the phone. It's not a problem. Okay, please don't hesitate to do that. I don't want you upset and things, and yeah, I know it's not very nice, is it? Yeah, okay. But I'm hoping we won't have to wait too long. I think dermatology is quite flexible at the moment. They're looking quite good, I think I can remember. Orthopaedic is probably a bit of a wait, but like I said, I will try and escalate that for you. Yeah, and then we'll see about the others and we'll go from there. Okay, great. Remember, if you do need any advice, please, ask the pharmacist, or send a message over, and I can see if I can give you some information on anything at all. But have a look on the internet, and like I said, I don't read too much into that. Alright, you're very welcome. I will look forward to speaking with you soon. Okay, I will call you in for a follow-up after all this has been sorted out. Okay, you're very welcome. You take care now. Bye-bye.